A person can probably observe people with a lot of different illnesses carefully for an hour or so and collect a lot of good information about what they can and can't do, how severe their illness is, and what their usual symptoms are from day to day. But ME is not one of those illnesses. ME is not at all a stable illness. Observing the average ME patient for an hour, or even a week or more, will not give an accurate indication of their usual activity level, because the severity of ME can wax and wane throughout the month, day, week, and even hour. People with ME can also sometimes operate significantly above their actual illness levels for short periods of time thanks to surges of adrenaline, albeit at the cost of severe and prolonged worsening of the illness afterward. Relapses and worsening of symptoms in ME are also very often significantly delayed. There may be both an acute and a delayed reaction to overexertion. Adrenaline is often referred to as the fight or flight hormone, as it kicks into action in situations of potential danger. But adrenaline also kicks in when the body is in physiological difficulty, which is very often what is happening to severe ME sufferers right before an adrenaline surge. Adrenaline surges make the heart pump faster and raise the blood pressure, forcing blood around the body with greater force to supply the muscles with more oxygen so that they can make a greater effort. Surges of adrenaline increase the metabolism, and they also relax and dilate the airways so that more oxygen than usual can be taken in. Adrenaline surges can also decrease the amount of pain felt. As a result of all of these factors, adrenaline surges, while they last, have the ability to increase physical speed, strength and other physical abilities in the ME patient. Unfortunately, when bursts of adrenaline wear off, as they must, people with ME are left far more ill as a result for many days, weeks, months or years. People with ME are harmed in various ways by adrenaline surges. For every short-term gain that they appear to give, there is a far greater loss overall. Because ME is not a stable illness, just observing someone with the disease do a certain task, once or twice or a few times, should not be taken to mean A, that they can necessarily repeat the task anytime soon, B, that they would have been able to do this same task at any other time of day, C, that they can do the same task every hour, day or even every week or month, or D, that they won't be made very ill afterwards for a considerable period because they had to really push themselves to do the task. Often a considerable rest period is needed before and after a really big task. For example, someone might need 2 weeks rest before an outing, a doctor's appointment say, with a short shopping trip afterwards, and may then spend 3 weeks extremely ill afterwards recovering from it. So if you just happen to see them in the 2 hours they were out and about and mobile, that's of course not at all representative of their usual activity levels. Most importantly, because the worsening of the illness caused by overexertion may not even begin until 48 hours or more afterwards, when most observers are long gone, it's impossible to tell by seeing an ME patient engaged in an activity whether that activity is so far beyond the patient's limits that will end up causing a severe or even permanent worsening of the illness, or a relapse. To be blunt, the activity may even contribute to killing the patient. This isn't common. The death rate of ME is estimated at 3% by Dr. Dowsett, but deaths can and do occur and are related to overexertion very often. So observers who see an ME patient engaged in an activity have no idea what the consequences of this activity may be, as well as what the patient's usual activity levels are like and what their daily life is like and how restricted it is. It's really important with ME not to make superficial judgments based on observations and appearances. If you want to know how well someone with ME is and what they can and can't do, the best thing to do is to ask them.